Management. We have to educate the mother regarding prevention and spread of the infection. Adequate supportive care should be given. Follow up of growth and development. Follow up the universal precautions. Universal precaution. Consider all the parents are infected. We have to follow the strict hand washing. That is gloves, gowning, masking, goggles. Do not recap with needles usually when already how to take care of the HIV patient. After giving any injection, we should not recap it. Appropriate management of spilled blood and bloody body fluids. Special care specimens be sent to the various lab. Birth injuries. There are various birth injuries factors cause the birth injuries. The one cause is like a uterine dysfunction. If because of the uterine dysfunction, the labor cannot be progressed, because of the prolonged labor will be there. Post-term and post-term labor, pre-term and or post-term labor, the baby will born before 37 completed weeks or post-term labor after 42 weeks completed. Cephalopelvic disproportion, that is baby head will be bigger than the mother pelvis size. Because of that, there is obstruction will be there. Multiple gestation. Multiple gestation means there is 2 or 3 babies in the mother womb. Then this dystocia caused by fetal macrosomia. Then congenital anomalies, then instrumental deliveries, forceps and vacuum extraction. These are all the will cause the birth injury. Cephalohematoma, caput succedaneum. Okay, this is caput succedaneum is actually that is bleeding will be present in the scalp, between the scalp and skin. Okay, this is cephalohematoma. There is a bleeding present in the this membranes and skull, between the membranes and the skull. Okay, then injury to the soft tissues like abrasion and laceration, erythema, ecchymosis, petechiae, edema of the buttocks, extremities, dislocation of the presenting parts. Okay, nursing care, we have to observe the baby, then clean, apply the antibiotics as ordered. This lesion will be healed within 2 to 3 days. If not, due to thrombocytopenia and purpura will be there. Subconjunctival okay, injuries to the bones. Okay, fracture of the skulls, intralineal or depressed. Then fracture to the clavicle. More commonest bone may be occur in the middle third of the bone. Shoulder dystocia. Okay, injuries to the bones like a fracture of the clavicular. Limitation of the bones affected slides when the baby is delivered. During that time it will be affected. Okay, the palpable bone irregularity, cripture over the, if we are putting upwards, that is a sound will be, cracking sound will be there. Absence of Moro reflex, affected side. Healing occur within 7 to 10 days. Okay, fracture of the humor and femur bones, lack of spontaneous movement, pain, passive movement. Fracture is confirmed with X-ray, and immobilization of the affected limb with spleens and spleen other disease. Healing takes place within 2 to 4 weeks. Peripheral nerve injury, that is Erb's palsy. Erb's palsy or Vater hand, we'll say as a brachial nerve paralysis or Vater hand. This is injury to the upper portion of the arm resulting from the undue pulling of the head away from the shoulder during the difficult birth. During the delivery, usually before taking the internal rotation of the shoulder, forcefully they will remove the baby. It will cause, there are commonest types of paralysis. Here the baby's elbow will be flaccid arm and elbow is extended and the hand is rotated inward. The hand will be rotated pointed inward like a waiter tips. If you want to take any tips, how the waiter is asking like this way, the hands will be there. Then absence of the Moro reflex will be there to the affected side. Okay, Moro reflex, you know that whenever we are putting the baby, suddenly if you are making any suddenly we are dropping the extension of the hands and the flexion of the abduction of the hands and the extension of the hand and fanning of the finger. This Moro reflex will be absent in this case. Okay, proper positioning and intermediate